Alright, Rogers, let's see what you've learned. First question, nice and easy. Identify the specimen.
Muscular tube with a blind end, the appendix.
Oh, well done. You managed to identify the appendix. I'm proud of you. Not that it's written right there in the notes or anything. Next question. What's the pathology here?
Diagnosis, appendicitis, and the differential, Meckel's, diverticulitis, and then, a ruptured ectopic pregnancy.
Look at you, Rogers. Almost like you know what you're talking about. Meckel's diverticulitis, ruptured ectopic pregnancy, well done. Any chance you remember the rest of the list?
Oh, right, there's a perforated ulcer, middle schmers.
Middle schmers? Really? Middle schmers, Rogers. I mean, I knew you weren't paying attention in that gynecology lecture. But please, it's middle schmers, not middle schmers. Nice try though. Go on, you were close.
Mittelschmers, right, and, salpingitis. No, salpingo-oophoretis.
At least you got there eventually. Go on, finish the list.
Lobar pneumonia.
Ah, yes. Lobar pneumonia? Because apparently, lung problems love to hang out with appendix issues. Nice save. Let's see how you do with the clinical features. What are the symptoms?
Pain that starts around the umbilicus and then moves to the right iliac fossa. There's also abdominal pain when coughing, nausea, vomiting, anorexia.
A textbook recitation so far, but I sense a storm coming.
Oh, and constipation or diarrhea, depending on the position of the appendix.
Oh, Rogers, using your brain now. It only took 3 questions to get there.
There's also fever, low grade, and, tachycardia, right.
Yes! You've cracked it. Onto signs, unless you plan on making me proud twice in a row.
Okay, signs. Tachycardia again, tenderness and rebound tenderness in the right iliac fossa, McBurney's point. And then there's, Rovsing's sign, press on the left, pain on the right.
He's on a roll, folks. Go on, hit me with more brilliance.
SOS test for a retrocecal appendix. Obturator test for pelvic appendix.
My goodness, Rogers. Have you been studying, or did you just suddenly become a genius?
And Baldwin test for retrocecal appendix too.
Oh, now you're just showing off. What investigations would you undertake, oh wise one?
Baseline tests like FBC, LFTs, UNEs. Imaging like abdominal X-ray, ultrasound, and a CT scan. Laparoscopy if needed.
Incredible! You remembered all of that without stumbling. Maybe there's hope for you yet. How about management, Rogers? Can you handle this one?
First, antibiotics, analgesics, and rehydration for the ABCs, and then, surgery, appendectomy. Using the gridiron incision at McBurney's point.
Wow. Did you read the book cover to cover this time?
Of course.
I mean, with that level of detail, I almost believe you. Alright, let's push you a little more. What are the anatomical positions of the appendix?
Retrocecal, prealil, postalil, pelvic, subcecal, and paracecal.
They grow up so fast. Alright, let's say a patient comes in with right iliac fossa pain and ends up in the theater for an appendectomy. How did they present?
Pain starting at the umbilicus, moving to the right iliac fossa. Anorexia, nausea, vomiting, fever, and reflex vomiting.
Reflex vomiting? Oh Rogers, I'm glad we're not basing your future career on this. It's just vomiting, my friend, no need for fancy reflexes. Now, give me the complications of appendicitis. Don't mess this one up.
Peritonitis, septicemia, appendicular mass, abscesses, pelvic abscess, gangrene, and intestinal obstruction.
Oh, look at you. You just made my day. Correct, for once. Last one, Rogers. How do we treat this patient? Don't leave out anything.
Resuscitation, surgery, appendectomy. Then post-op, give antibiotics like benzylpenicillin, metronidazole, and gentamicin. And supportive care with analgesics.
Well, Rogers, you've done it. I didn't expect you to remember so much, but here we are. Just don't forget, there's always Mittelschmers to keep you humble.
I won't forget, Dr. Mavania.
You better not, or next time I'll quiz you on gynecology.